Good evening. My name is Anna Yugi Mwanga, tutor from Ginger School of Nursing and Midwifery. I'm back with our practical session, mostly on assessment tasks. This evening, I would like to talk about breaking bad news in palliative care course unit. Breaking bad news can be also examinable as a practical, and the task can be you are required to carry out breaking bad news or break bad news to a palliative care patient who is seated right here. So how would you approach that task? You'd start by, of course, after the preamble, you've greeted and everything, the basic things that you always do. Then let the Madam Examiner or the examiner get to know that breaking bad news would follow the 6 steps protocol for breaking bad news by either Bachman or Spikes. For that matter, you would choose one. Let me say if you chose Bachman, you would start by saying step 1 is getting started. And as you are getting started, you ask questions like why, where, who, whom. That is getting started. Where would it be appropriate place to break bad news? And how is the approach you'd take to break bad news? When is whether the client, you assess whether the client is ready to receive the bad news there and then or sometime later. And then whom, you also try to find out from the client whom they want to be with to receive the bad news, or they would like to be alone. That is getting started. Then step number 2 is finding out how much the patient knows. That you need to first assess your patient, what much they know concerning the topic you are going to discuss with him or her. That is finding out how much. For example, if it was breaking bad news in terms of delivering HIV test results, of course, some people may have a misconception in vernacular as they say positive means good and negative means bad. But now it is the vice versa with HIV test results. So it's good to find out what much the patient knows so that you know where to start from and also what clarification you need to make. Step number 3 is finding out how much a patient wants to know. This is quite different from what I've just said. Finding out how much the patient wants to know. For this matter, some people do not want to know much in case the news is bad. They don't want now a lot to be told to them because it's already bad and they are disturbed. But others may still be very inquisitive to know more details about concerning the issue, even if it is bad. So it's good to find out this kind of client you are dealing with. What much do they want to know concerning the information you are yet to deliver to them? Then step number 4 is sharing the information. That is now when you try to give the details of what you intend to tell the client. Then step number 5 is responding to the patient's reaction. And when you respond to the patient's reaction, it depends on how the patient has reacted, because there are different reactions that the patients may respond to the bad news. For example, crying, denial, anger, guilt, and so on. So you pause and wait to see how the patient would respond to the bad news, then you can act accordingly. Then step number 6 is planning and follow through. Of course, having given the bad news to the patient or client, you don't leave them just like that. You'd find a way forward and see how you can help them better or what follows after the incident. So that is the 6 steps protocol by Bachman. But if one chooses to use spikes, the word spikes, S-P-I-K-E-S, each letter stands for a step. So step number 1 in Spikes, breaking bad news by Spikes, it is S stands for setting up, and that is also what, where, who, like that. You ask such questions. And P stands for perception, how much the patient knows, assessing a patient's perception. And I stands for invitation, finding out how much the patient wants to know, obtaining patient's invitation. Then K stands for knowledge, you give knowledge and information to the patient. And then the other is E stands for emotions, and you have to address the patient's emotions with regards to the bad news you've broken empathetically. And S stands for strategy and summary, whereby you make the problem list for the patient, prepare them for the worst and hoping for the best, and identify sources of support. So it's like planning and follow through. So these are the 6 steps protocol by Spikes, at the same time by Bachman, on how to break bad news. And sometimes you can use the acronym break news. The word break, B-R-E-A-K. B stands for be prepared, R stands for relatives, E stands for expectations, A stands for assess what is appropriate, K stands for knowledge sharing, N stands for nothing, that is now news. News, N-E-W-S. N stands for nothing you can do, never nothing you can do. And E stands for empathy. The W stands for way forward, and S stands for stop and reflect. So you can choose to use the acronym break news to break bad news, or you can follow the actual 6 steps by Bachman or by Spikes to break bad news. So let me just try to demonstrate exactly being in a exam room, as assuming I'm the student and I'm talking to the examiner and a client. Good evening, madam. Good morning, madam examiner. Good morning, my patient. Madam examiner, I have a task to carry out concerning breaking bad news. Patient, I've been requested to come and deliver some information to you that you are waiting for, but may not be good. For that matter, I would first of all like to know, where should we sit? Whom can be present with you? And when would you like to receive this bad news? So whom is there any relative around whom you'd want to be with you? Where is this appropriate place, or we can locate ourselves to a more private place? And when are you ready now, or you would want to give yourself time to receive this bad news when you're a bit composed? That is getting started. Madam Examiner, step number 1 by Bachman.